Hello and welcome to Healthcare Voices, where we bring you authentic voices behind healthcare innovation and impact. I'm your host, Katherine Cummings, former clinician turned healthcare technology advocate. And today I have the privilege of speaking with Dr. Blair Suter, a cardiologist at Ohio State University. Dr. Suter will be sharing his insights into how technology has impacted cardiology care and about some of the new technologies being used to transform cardiac care. We are so excited to have him on the podcast today. Thank you so much for joining us, Dr. Suter.
Well, thank you so much for having me, Catherine.
Dr. Suter, tell us a little bit about your background and what inspired you to pursue a career in medicine.
I'm originally from West Virginia and then had a background briefly in undergrad in biomedical engineering. Went to medical school in West Virginia and did my residency in internal medicine and pediatrics in Indiana, in cardiology fellowship at University of Cincinnati. Now I'm an assistant professor at Ohio State University and have a volunteer assistant professor role at University of Cincinnati as well. I'm also a father, have two kids and a dog and a loving wife too. My main areas I'm interested in cardiology are cardiac imaging, preventive cardiology, and global health and medical education.
Awesome. Thanks for sharing that. I'd love to know a little bit more about what you find most rewarding about patient care and really how you stay passionate about your specialty.
As far as patient care goes, I really enjoy building longitudinal relationships with people, being seen as someone people can trust, trying to use all of the knowledge that I've spent the last 10 to 15 years trying to know as far as medicine goes and all the stuff that I still spend time reading about, staying up to date on every day to try to help people apply that as best as possible for their lives, to try to learn about what might be important to them, try to help guide people, and try to help, suggest without telling people what to do, but just trying to help, provide a resource for people to understand as most about their cardiovascular health as possible.
So, I've been reading a lot lately about the role of genomics and genetic testing in early detection of gene variants that might cause cardiovascular disease. I'd love to spend a little bit of time talking to you today about some of the new innovations happening in that space and really how they're impacting your practice and cardiac care in general. So, I'd love for you to share that with us.
Yeah, I think that's a great question and something that we have people brought up all the time. So um, I see patients for all types of different things in my cardiology clinic. And one of the main things that I do see people for is preventive health visits. Um, And in terms of uh, thinking about preventative health and how it relates to genetics and genomics, I start dividing it up almost in two separate categories. So I believe that you'd mentioned uh, cardiovascular medicine or coronary artery disease. Coronary artery disease is a really interesting one from this perspective because the there aren't necessarily single genes that are the ones that we're finding most responsible for coronary artery disease. The types of things that you'll see in the genomics or genetics realm now are people talking about polygenic risk scores, which is kind of a complicated term, essentially saying that while we have billions of genes, many of these kind of come together to try to assimilate this risk that you have for coronary artery disease. I've seen studies where they talk about over 60 factors that they'll put involved in trying to determine people's risk for coronary artery disease, 60 different genes. And I think about the kind of the alternative to that being things that are a single gene. And this is something it's hard to explain, but something I come across every day. So something that would be a single gene or genic or monogenetic are certain conditions in cardiology, like heart failure sometimes, certain types of heart failure, certain types of family cholesterol disorders, that it's only a single gene out of the entire genome, out of this billions of genes that are responsible for those type of things or those type of diseases and pathology. So when we're trying to break this down and think about it, we're starting to see more of these polygenic risk scores or these risk scores where they take into account a lot of different genes on the horizon. Some of those work is being done through UK Biobank. Some of that's being done by other people in the country as they're trying to kind of put together and try to figure out what are the most important things to try to predict people's risk for coronary artery disease. But that was a good question, Catherine. It's a really kind of complicated answer. We could go into a whole lot of depth on that. I guess one other thing I'd say, as far as that goes too, is that genetics and genomics is such a rapidly changing field that it's important to take a team approach to this. There's people whose entire career is to be a genetic counselor, and I learn from them all the time too. Um, Different variants of these genes go through different periods in their lives where we may not know very much about it in 2024. And by 2030, we may know a whole lot about it. We may understand a lot better how it impacts your risks of cardiac disease or other types of disease too. Um, so kind of making sure that you're plugged in with genetic counseling, people who really like spend the majority of their time in genetics, or at least work alongside those people when you're ordering genetic testing or trying to think about those risks is really important.
I know that genetic counseling is obviously an important part of like maternal fetal care. But are you seeing more genetic testing being utilized in specialty practices like cardiology or things like that?
Yeah, so I regularly refer people to genetic care. Probably the main conditions that I see are not more of the ones that I mentioned, the polygenic, or the ones that, you know, coronary artery disease may have 60 different genes responsible for it. But some of these conditions that I really think may have one gene or something like that, the biggest ones we see are some of these cardiomyopathies, dilated cardiomyopathy, so dilated heart that's weak, so it runs in families, hypertrophic cardiomyopathy, certain types of arrhythmias, certain types of family cholesterol disorders. Um, but I'd say that in terms of these referral too, a lot of times I'm coming already with a good amount of data that I've talked to this person about, and I've asked them. I've really tried to probe, and I've really asked them to probe to their families about, what conditions did your mother have? What conditions did your father have? And really trying to build up to a 3-generation family tree if possible. Now, genetic counselors will build a better family tree than any physician or nurse that I've ever seen, or anybody else. They'll find out things that you would have never imagined. But trying to put all that together, especially for these things that may just be caused by a single gene, I am referring people to genetics pretty regularly.
Aside from those tests being available to detect early risks, how can this data be used to help kind of preventatively optimize risk for heart disease or cardiovascular disease?
Yeah, that's a great question, and still one that's I think controversial isn't the right answer, but still we're trying to figure out exactly where that comes in. We have some pretty well established things that we already, like, pieces of data about you, about our patient. We have well established information regarding your cholesterol. We have well established information about high blood pressure, about risks that come directly from your family tree. And then we also have kind of an imaging approach. And this is something that I'm really interested in too, is cardiac imaging with cardiac CT scans and coronary artery calcium scores being ways that we can try to find disease before it's at the point where it's clinical or it's pathologic. So we have a pretty established routes already that we look at, and trying to find a way to make sure that we're fitting in these kind of polygenomic or polygenetic risks into that to figure out, well, we have all this information already. Does this add to it? Does this subtract to it? Does this take us 5 years prior? And it's still a little unclear from most of the research that's being done on it. There's still research studies getting published on this every month. People trying to sort out which are the best ways to try to predict these things in advance. Because significant cardiac disease, or a myocardial infarction, a heart attack, is one of the most significant things that can happen in a person's life to impact their health. So trying to find any ways we can do to bolster our preventative care is really important.
So, kind of along the same topic, I think since COVID, we've been seeing a lot more primary care physicians or providers transition over to this concierge medicine model where patients essentially pay an entry fee to get personalized care from a physician. In the last podcast, I had an interview with advanced practice nurse Michelle Whaley, and she told me that a lot of neurologists are actually making the switch over to the concierge model because of challenges with reimbursement and not being able to see patients in time, things like that. Are you seeing those types of trends in cardiology, and especially as we're talking about those preventative things, CT scans, and needing to get these preventative things in early? What are you seeing there with concierge medicine?
That's a really interesting question. I don't think I'm seeing it quite as substantially as what was mentioned. I am seeing patients when I'm reading CT scans that are sent by essentially concierge cardiologist or direct care cardiologist. And we even have through university that I'm at, there's even becoming more of a direct patient care or a direct care, a few cardiologists that are involved in that now too. So we're starting to see some of it. I'm not seeing, I would say, lots and lots of people already heading away. I think in cardiology, a good amount of what we do revolves a lot around a lot of fairly sophisticated testing, either cardiac imaging testing, kind of building a cardiac team in terms of having electrophysiologists, cardiac interventionalists, cardiac surgeons. That I kind of wonder that we may not see it quite as much as that they've seen in other specialties until a little bit later.
Definitely. I know that I've been hearing, or I guess seeing more podcasts, I think, about especially the CT scanning early to see any kind of changes in cardiac function, or any calcium buildup, things like that. So it's just really interesting to see how people are tackling issues of longevity and health early more often than ever, really.
In terms of CT scanning too, we have kind of direct protocols for what to do for preventive care now. But even beyond that, there's still plenty of research going on, both United States, Europe, other places, trying to find better ways to find different types of, heart disease, find it different ways, and then also figuring out the most efficient ways to do this too. When we're talking about preventive care, thinking about things that can be applied like population wide too. So the efficiency is really important.
That's a really good lead into my next question, actually. So I've had several conversations about health equity on the podcast, and I think it's obviously an important topic, especially as we think about rural hospitals, critical access facilities. But I think more and more urban populations are really impacted, especially from the community health perspective. And we continue to see critical clinician shortages, which makes patient education and health equity even more imperative. So my question is, how is your practice utilizing tools such as apps, wearables, other more accessible technologies, maybe, to make cardiac care more reachable for marginalized communities or communities that have challenges getting, getting in to see you?
Yeah, I think that's really important. As a lot of these wearable and other technologies are coming online, I think we have to be a little bit scrutinous of them in terms of which things are FDA approved, which things that we truly think are reliable. And then as the cardiologist, it actually takes a bit of my time trying to figure out what algorithm different tools are using, when they're reliable, when they're not reliable. So there are a few specific tools. This is not an ad or anything, I have no disclosures, but one we recommend often is one called Mobile, and that's FDA approved. And as more things come online that are FDA approved in terms of wearables and home monitoring, I'm sure there'll be plenty of other things that we're recommending more frequently too. Um, but I see both patients inner city and urban, and then patients rural who may be coming 2 to 3 hours to Columbus, Ohio to see me in their care. And this is a way that I can communicate with them by having remote technology evaluate them, having, heart monitoring essentially. So we are finding ways as there's more things like wearable technologies to try to figure out which things can be most reliable for our patients. This can be as easy as blood pressure cuffs or as common as blood pressure cuffs. And then now into more wearable technologies or home technologies that can measure your heart rate, can screen for heart arrhythmias. Um, One of the big considerations in these is that some of these devices are FDA approved and some of them aren't. They don't all use the same technology. So me as a cardiologist, trying to spend that time figuring out which ones have the the best algorithms, the most appropriate technology for what I'm trying to find out for my patients is still difficult, and it's something I definitely don't have all the answers to. Is there's so many different ones and so many new types of wearable technologies are coming online all the time. I think that it's going to be, it already is, but is going to continue to be more substantial and allow us to interact with patients who may be a couple hours away, may allow me to have televisits or interact with these patients when I can get essentially their vital signs already at home and something near an EKG at home that they can stay, at home 2 or 3 hours away and interact with a subspecialist in a bigger city.
Looking ahead, what do you believe are some of the most pressing challenges and opportunities in leveraging technology to advance cardiovascular care outside of these wearables and these apps that you're talking about? And how do you see cardiologists adapting to meeting these challenges in the coming years?
I'll probably talk about two different areas. One of them is just near and dear to my heart as a general physician, is figuring out how we're using technology in terms of the electronic health record to make, and I'm sure people have talked about this on the podcast already, to make our lives more efficient. We have some artificial intelligence based technology that we're going to start using more wide scale where I work, in terms of a way to try to help you document, legally, clearly, and patient facing essentially. So trying to figure out how to continue to build the electronic health record as a tool for us as opposed to a burden. The second thing I'd talk about is more cardiology specific. And even some of it's going to relate back to things that we'd talked about before, being cardiac CT specific. So with cardiac CT, I think we're really on the verge of being able to tell a lot more about really what's going on inside your heart arteries, being able to predict some of these things more, like is something going to cause a heart attack. So by both improvements in the imaging technology, but then also artificial intelligence and machine learning, you clearly guided by physician and other healthcare provider understanding, but um, trying to improve this imaging technology so it can give us more and more information, that it can really tell us more and more about our risks and more about the underlying pathology non-invasively from the outside of your body.
So, when Dr. German was on the podcast, he mentioned the importance of developing strong relationships with other clinicians so you can kind of better collaborate with just a phone call. You mentioned earlier that you are working with physicians who are kind of managing all the genetic testing and genomics. How do you approach the management of patients with, especially patients with multiple existing conditions, and how do you collaborate with other specialists to approach patient care from a holistic perspective?
Yeah, I think that's crucial in our care of patients. I've had to meet or talk over the phone to so many different docs here. Being in the university and academic setting, I have a lot of patients um, who the heart problem or the cardiology problem may be lower down on their list of their main problems overall. They may have cancer, they may have surgical needs. So just picking up the phone or politely reaching out to people is never, it always ends up being a much more pleasant and amiable discussion that I'm having with people. And sometimes if you're just using notes, to send back and forth, we miss out on a lot of verbal cues from people. We miss out on a lot of understanding. So getting to know your colleagues in that way um, teaches you a lot of medicine too. And I think it really helps holistically care for the patient, because at the end of the day, you're their healthcare team. And if you're all operating in silos, then that's not doing anything good for the patient. and it's definitely not coordinating their care to help move forward. So I would say that I pick up the phone and I'm calling people every week, if not every day, and many of them are people I've never met before too.
So, looking ahead, what excites you the most about the future of cardiology, and how do you see those advancements really impacting the way that you provide patient care?
Oh, uh, I've, I'll keep talking about, one of my favorite things again, which is cardiac CT. So as we talked, I think this technology is going to really burgeon, and we're going to really be able to pick up patients who may be at risk of having a heart attack, many years later, 5, 10 years later, and try to really help be able to guide people in terms of, how do we need to treat you? How do you need to live your life? So that's probably the area I'm most excited about overall. And then I'm really excited too about seeing how artificial intelligence and machine learning is going to um, adjust some of these imaging modalities that we use in cardiology. It's a big part of what we do, and to help essentially standardize this so that anybody anywhere in the world um, can use these technologies wherever you are. So kind of beyond the cardiac imaging and well, including of it too is kind of subspecialty care like cardiology and other areas just really expanding around the world too. Um, I know that's not something we've spent the most of our time on, but I think a lot of this stuff is developed that we can try to try to teach what we know here, that we can try to pass along technologies that we're developing in the United States and Europe, in Asia, other places to countries that are more on the developing side to low and middle income countries. And a lot of it begins with just knowledge transfer too. So that's something that I've been involved with and engaged with for several years, is trying to help make healthcare technology, help make cardiology education something that's more equitable and spread kind of worldwide.
That's really cool to hear. I have one final question for you, and it's a question I ask everyone on the podcast. What's one thing that you think clinicians want their patients to know, or even other people in the medical field to know?
Well, I've heard this one from other people, and I want to try to put my own spin on it a little bit better. But the it goes along the line of almost treating that appointment or that visit with your physician the same way that you would go with your accountant. So thinking about the things that you know that are important for your health, uh, important aspects of your health history, your family history, trying to understand or keep records about what trends of what important data are over your lifetime, whether that's imaging tests, whether that's laboratory data, and even if that's data that you're tracking related to your diet, related to your exercise. So I think trying to really keep an eye on it. The other thing I'd want people to know too is that some people I think get a little intimidated by that. Some people get intimidated by the healthcare system in general. Almost all doctors, people aren't going to care if it's been a while since you've been plugged in with healthcare. Some people I've seen, especially in the past 6 months or a year, maybe somebody who really needed to be seeing a doctor or a cardiologist on a yearly basis, and they're coming back over many years. And I think sometimes people are almost ashamed to return to seeing the doctor. They're scared of what the doctor might say. They're scared the doctor might say that, oh, this was so bad of you not to come in. But for all physicians, doctors, nurses, people in healthcare are compassionate people, and we want what's best for you. So we're happy to get people plugged back in like that who may not have seen a doctor or been engaged in healthcare for many years. Those are many of my favorite patients to see, and try to help figure out, what happened, what their understanding of their relationships prior, what their understanding of their current medical conditions are too.
Well, Dr. Suter, thank you so much for sharing your experience. It's been a pleasure to have you on the podcast, and I look forward to keeping in touch and continuing to see how you engage your patients in their care and continuing to hear more about how these CTs are helping evolve cardiac care. So thank you so much for joining.
Oh, thank you so much for having me, Catherine. I really appreciate it. It was definitely an honor for me to be on Healthcare Voices. Thank you.
Thank you to all of our listeners for joining us on the podcast today. We appreciate your support. To hear from more healthcare voices like Dr. Suter, hit the subscribe button and share this podcast with your friends and family. I'm your host, Catherine Cummings, and you just listened to Healthcare Voices.